Yes.
All right,
For our,
let's get started.
for our presentation, we decided to do the science and treatment of internet addiction in adolescents. What is internet addiction? The American Psychological Association defines internet addiction disorder as a behavioral pattern characterized by excessive or obsessive online and offline computer use that leads to distress and impairment. The American Psychological Association reports that teens spend an average of 4 hours a day on 7 social media apps alone, with YouTube, Instagram, and TikTok accounting for 87% of this time. Internet addiction is not a recognized disorder in the DSM-5. The DSM-5 does list internet gaming disorder as a condition for further study. Possible causes of adolescent internet addiction. One study found that youth with an ACEs score, adverse childhood experiences, of 4 or more were 3.1 times more likely to have problematic video game use and 1.6 times more likely to have problematic mobile phone use compared to peers with no ACEs. A study out of China also found that social anxiety was another contributing factor to internet addiction. Adverse childhood experiences. ACEs are disruptions to the promotion of safe, stable, and nurturing family relationships and are characterized by stressful or traumatic events that occur during an individual's first 18 years of life. Individuals are rated on a scale of 1 to 10 based on the number of ACEs they experience. Social anxiety. The DSM-5 defines social anxiety disorder as a persistent and intense fear of anxiety about social situations where the individual may be exposed to possible scrutiny of others, leading to avoidance or enduring situations with significant distress. Behaviors and signs. Some of the consequences or signs that this disorder that exists within this disorder will be more or less severe depending on the circumstance. Depression, social isolation, anxiety disorders, impulse control disorders, physical conditions such as weight gain, backaches, and carpal tunnel syndrome, inability to control internet usage, offline withdrawal symptoms, sleep disturbance, loss of interest in other activities, and mood changes such as mood swings, irritability, and emotional instability. The biological effects of internet addiction. The U.S. National Library of Medicine reports that there are neurobiological similarities between substance use disorders and internet addiction, with both conditions affecting dopamine levels in the brain, resulting in similar structural and functional changes.
Mhm.
Treatment modalities for adolescent internet addiction. Since the DSM-5 does not classify internet addiction as a disorder, there are no official treatment modalities. However, the mental health counselors we interviewed found the following modalities to be useful in treating internet addiction. Cognitive behavioral therapy, CBT, is a form of therapy that focuses on the relationship between thoughts, feelings, and behaviors. It helps individuals identify and change negative thought patterns and behaviors that contribute to mental health issues. Dialectical behavioral therapy is a talk-based therapy that focuses on teaching individual skills to regulate emotions, improve interpersonal relationships, and cope with stress. Eye movement desensitization and reprocessing, EMDR, is a therapeutic technique using rapid eye movement. It is used to treat conditions such as post-traumatic stress disorder and other conditions, including but not limited to distressing or traumatic memories.
All right. And then I think Miriam had something to say a little bit about this, the earth, wind, and fire.
So for part of the DBT and EMDR, the let me pull my thing. They she also, I think it was Julie, one of the counselors talked about earth, air, water, and fire. And earth is grounding, air is breathing for centering, water is calm and controlled for relaxation response, and then your fire is your imagination. And kids with or adolescents with internet addiction have a hard time with the fire element and their imagination with the inability to be creative and problem solve.
Yeah, that resilience. Awesome. All right. Now it's on to healing focused counseling.
Okay, so we interviewed the three founding counselors at Healing Focus Counseling. It is an outpatient mental health facility focusing on individual counseling with evidence-based practices, as well as alternatives ranging from yoga and massages to hypnosis. Their mission is to empower and help with transformative healing to their variety of people served, such as teens, adults, families, groups, and neurodivergent individuals. They do a variety of tasks such as billing, managing the facility, groups, training, coordinating with other people they work with, such as their Reiki masters. They provide healing. They prioritize having healing boundaries with clients, but also creating meaningful connection with their clients. That is mentioned as very important for teens struggling with internet addiction. And then the starting wage for individual therapists varies greatly depending on the location, insurance, how many people are paying without insurance, but the NASW ranges the wages from 53,774 to 95,688. Opportunities for advancement at their center. And private practice owners start their own practice, more autonomy and income potential, specialization, focus on trauma, EMDR, couples therapy, etc., to raise your profile and rates. Program director, manage entire therapy programs in clinics or nonprofits, overall job satisfaction. Overall job satisfaction for therapists tends to be moderately to high positive, but it varies based on the type of therapy work, setting, level of autonomy, and supportive infrastructure. Healing focused counseling organizational chart. So the executive leadership would be the three that we interviewed, which was Wendy, Rick Ryman, and Julie Matheson, who is also a founder. And then they're all three of them are part of the clinical team, as well as Angela Gerritsen, who's an LCSW. And then they have administrative and office managers. The organizational structure of healing focused counseling shows strong applicability to the field of social work, particularly in the following ways: leadership by licensed social workers, interdisciplinary collaboration, specialization in trauma and neurodiversity, administrative support for clinical practice, community and systems orientation, ongoing training and development. Overall review of website, therapist interview, and agency experience. The experience of exploring healing focused counseling, both through their website and the therapist interview, was overwhelmingly positive. The agency presents a professional, welcoming, and well-structured environment that aligns strongly with the core values of social work. The website is clear, informative, and provides easy access to therapist bios, treatment approaches, and holistic services. It emphasizes trauma-informed care, diversity of practice, and holistic view of healing, all of which are essential principles to contemporary social work. Interview offered personal insight into the compassion, ethical commitment, and practical challenges social workers face in private agency settings. It was encouraging to see clinicians who are not only highly qualified, but also deeply passionate about empowering clients and fostering growth. And then these were the three individuals that we interviewed and the founders of Healing Focused Counseling: Julie Matheson, Wendy Ryman, and Rick Ryman.
All right. Now it is on to my portion, which was the interview questions and answers. The answers were given by the three social workers, and they were very informative. Their answers differed somewhat from statistics already given in this presentation. This illustrates the importance of the boots on the ground information on projects such as this. First-hand knowledge is always an important factor on any topic. Our first question was, in your experience, how common is internet addiction in adolescents? Have you noticed a change of prevalence of IA in this group over the past few years? Their response: it has become quite common and is the root of many challenges in adolescent patients. Phones are more common at an earlier age and give access to lots of problematic things on the web. Grooming from predators has started at an earlier age. Furthermore, they have access to many problematic things such as internet gaming, illicit drugs, and especially pornography. This leads to sexual objectification and sexting. Pornography causes unrealistic expectations of sex and relationships. As a prevalence, there is a huge rise in these issues due to lockdown during the COVID-19 pandemic. One of the things that they commented on about the affecting the relationships is that now relationships have become very committed, very committal, and that people will not date around as much as they did, which Rick specifically noted that he felt was very interesting, because how could you possibly learn when you are very isolated and stuck to one person? He also commented on the various attachment styles that and the various attachments that these phones kind of introduce, of being very like needing someone to respond and needing someone to be there and present. So that was a very interesting question. What therapeutic modalities are often utilized when creating a treatment plan for adolescents with internet addiction? Cognitive behavioral therapy is commonly used for a top-down approach. What is impacting your decision-making? Why are you choosing to do what you're doing? Dialect behavioral therapy is used for bottom-up approach. This helps regulate the nervous system and put some distance between what is triggering them and how they respond to it. Eye movement desensitization and reprocessing can be used to help with self-esteem, substance addictions, behavioral problems, and the trauma causing it. What needs weren't being met or aren't being met? I think that this was very interesting, and I think that especially Wendy had some really awesome comments about the different kinds of modalities, and Julia also had that awesome comment that Marian previously talked about the earth, wind, and fire, and having that resilience and being able that creative, imaginative problem solving. Can you compare and contrast treatment of substance abuse versus internet addiction in adolescents? What is similar and what is different? Substance abuse affects the brains in similar ways to internet addiction. Substance abuse has a physical addiction component, but psychologically. The treatment is very similar. The questions are asked the same. What is the addiction covering up? Why am I using it? And what is it I don't want to connect with? Number 4, what have you noticed in the accessibility and availability of the internet in adolescents over the years? Social behaviors have changed due to their attachment to their phones. Phones alienate people from knowledge of self. Kids are more disengaged, disassociated, and disconnected than ever before. This causes kids with no reasons for attachment issues to have attachment issues. Adolescents face less adversity and have less resilience and lack creativity to solve their own problems. There it is again, that fire. They often use Google or ChatGPT to get their answers instead of figuring it out for themselves. One of the things that he mentioned is that there's a lack of connection almost for when these kids are trying to solve problems. Like if a student goes up to a teacher and says, "Can I have help?" A lot of the times we will kind of push off and kind of be like, "Oh, well, look it up on your phone, look it up on Google, look it up." And it kind of reinforces that instead of going for others for help and kind of you go, the first thing that you do for connection and for that problem solving is straight to your phones. And I thought that was a very interesting part. And then I can't see what slide I am on, but not. um, what number slide are we on? Let's see. Tony, is this your part? Yeah. Oop.
Okay.
Oops, one more. There we go.
Okay. Yes, right here. Do you find it common in adolescents with internet addiction to have experienced adverse childhood experiences, ACEs? In our culture today, you don't need a high ACEs score to struggle with internet addiction. Technology is available to everyone and mainly depends on how susceptible you are giving your power away to technology. How aware are adolescents of the long-term effects of internet addiction? And is it an epidemic their their generation even cares about? There doesn't appear to be much awareness in adolescents and their parents of the long-term effects of internet addiction. It does not seem to be something their generation cares about. What struggles do you see in adolescents with internet addiction? There's anxiety, depression, suicidal thoughts, lack of connections, social anxiety, many types of disorder and attachment issues. The overstimulation of information is often overwhelming. The struggle to build solid relationships. They want to stigmatize themselves and self-diagnose with Dr. Google. They see things like I'm a treatment kid instead of saying I'm a kid trying to get help. Our conclusion, internet addiction has become pervasive in our society, particularly among adolescents. The lack of awareness has become more common and it leads to
Not bad. That's me. Oh.
and it leads to a whole host of issues. Quickly evolving pace of technology often means we are having to play catch up for forever changing issues it causes. Most social workers are aware of the problem, but the general public is not.
Oh, hi. I think that is our presentation. So thank you so much. I'm going to pop myself into the Zoom call so you guys can make sure I'm here. But yeah, thank you, Ashley.